See what else? Oh, for instance, if you were to look at the occipital cortex back there where the primary visual cortex is, maybe half of that visual cortex is taken up by this maculodudia. It is really the center of vision. It's quite important. Okay, and I want to show you a few things that show up well on this model. So this is a cross-section model. Okay, so there's the cornea. Okay, cornea, that's the lens. Okay? And there's the iris. Okay? So notice, okay, behind the lens, there's this big space. Okay? This big space is the posterior cavity. In life, it's full of this gelatinous-looking stuff called the vitreous humor, which we should be able to see when we do the dissection. Okay? In front of the lens, in these two areas right here, this is where, that's the anterior cavity. Okay? The anterior cavity is where the aqueous humor is. Probably see a little bit of that. Okay? And this anterior chamber, or this anterior cavity, breaks down into an anterior and posterior chamber. They're divided by the iris. Okay? What else does it show? Okay, so this is where the optic nerve leaves, so that's the blind spot. Okay? And this is where the light focuses, so that will be the maculodudia. And right dead on in the middle of the maculodudia is the fovea. Okay.
And fovea is just a concentration of cones, right? Or rods?
It is, yes, it is all cones in the fovea. The other thing is, I don't know whether you talked about this in lecture, but you know the retina is upside down? Did you talk about the retina being upside down? Yes? No? Oh, well, never mind. The retina is upside down in that the photoreceptors are at the bottom of the retina, okay? And the amacrine cells and the ganglion cells and the bipolar cells and all the cells that process the light, they're on top, okay? So the light has to go through most of the retina to get to the photoreceptors. But at the fovea, the reason it's a pit is because all the other stuff is pulled out of the way. And just at the fovea, the light goes directly to the photoreceptors. Okay, so that's another reason why it's a special part of the eye. Okay? All right. So let's see, now we need to do an eye dissection.